Hi, Dr. Kiltz. How you doing? A beautiful day. We had a great webinar a couple weeks ago, and we got a ton of questions still remaining. We're going to work to share these on some video blogs, and we're going to do some more webinars. And your questions are really important to me, and we want to make sure that they're getting answered appropriately. And one of the questions was, how does PCOS, polycystic ovarian syndrome, actually affect infertility? Well, this is one of the interesting things that we don't really know exactly, because there are many women with polycystic ovarian syndrome and anovulation or infrequent ovulation that get pregnant. But we think it mostly has to do with not ovulating or irregularly ovulating. Now, in general, if you have 28-day cycles, you're releasing one egg per month, usually about day 14 of the cycle. There's about a 20% chance for conceiving per month with that. Now, polycystic ovarian syndrome, metabolic syndrome, I think is a better term for that. We think that the inflammatory response, the high insulin levels, the high androgen levels, may be a factor in preventing the regular maturation and release of the eggs. Now, we're not sure if it's a pituitary level or the hypothalamic level or a peripheral level of the high inflammatory process, the high androgen process, or is it really just a local level of the ovary where the androgens and the high insulin levels and maybe even the high sugar or carbohydrate levels may be affecting that? We're not sure. Some treatments that we highly recommend include a low carbohydrate diet, high fat diet, adding glucophage or metformin, which may help modulate the insulin levels, which may help modulate the inflammatory response and or the androgen levels, may help increase ovulation. It may be for many there's such a high inflammatory reaction that it's affecting the egg and the sperm and the interaction which in the insemination fertilization process. It may affect the implantation process, but mostly we think it affects the ability of the egg to get out of the ovary in a systematic fashion, timed with the normal progesterone rise, the fertilization, and the traveling down into the fallopian tube. So treatment also with things like letrozole or Clomid, and we typically recommend more Clomid now more letrozole, because the Clomid seems to have more of an adverse effect on the uterine lining, and also it affects the moods, blurred vision, more depression and headaches. So by using letrozole, we all think that it has a better response, and there have been some studies that are showing that letrozole is actually higher pregnancy rates also. Some other treatments include a laparoscopy with ovarian drilling, which I like to call ovarian acupuncture. And that would be a treatment after you've failed things like glucophage, metformin, and letrozole or low-dose injectables. And then finally, there's adding gonadotropins to directly stimulate the ovaries. It tends to increase the risk of more eggs. More eggs increase the risk of multiples, so conversion to IVF may be a reasonable process to increase your outcomes. So these are some thoughts on polycystic ovarian syndrome. Check out seemyfertility.com. Any other questions, we're going to come and join and share some other. God bless. Enjoy the day.